Welcome to the use of Twitter data to monitor and predict flu epidemics in Ireland. Our research question is, can we use Twitter data to monitor and predict local epidemics of influenza in Ireland? This presentation will cover some background to the problem space. We'll do a review of the literature and cover related work on monitoring systems, prediction systems, different diseases that have been targeted, some techniques for locating social media messages geographically, and some text classification systems used in the area. We'll present a plan for answering the research question, and then we'll come to some conclusions at the end. Regarding the background, our flu season in Ireland runs from week 40 in the late summer until week 20 the following year, which is late spring. We really only have about 12 weeks with no flu activity at all in the year. The job of monitoring the flu activity falls to the HPSC, the Health Protection and Surveillance Centre. They use a network of Sentinel GPs and also data from the National Viral Research Laboratory. Most people only get mild flu, don't need to see a doctor. Flu is only a problem for vulnerable groups, such as the elderly, the very young, or the chronically ill. Flu can have serious complications for these groups, and this is where pressure on hospital resources and pressure for hospital beds comes from. We see during acute phases of the influenza season that hospitals are seriously under pressure to provide resources to cover patients in crisis. Why should we use social media? Well, traditional methods can only count the severest cases and can be biased towards picking up data from vulnerable groups, as mentioned before, the elderly, the young, or the long-term sick. Social media gives us an opportunity to observe instances of influenza which may never get in front of a doctor. All the data from social media is accessible. It's out there in the public domain, and it's not clinical or sensitive data. And people have already implicitly given their consent by posting it up on a public forum. It has the potential to offer a stream of automated passive data capture, which is ideal for surveillance purposes. Twitter is well used in Ireland. Over a quarter of Irish people over 15 have a Twitter account, and 1 million tweets are sent from Ireland every day. Our goals in using it would be to anticipate traditional methods and forecast flu rates slightly into the future. We'd wish to assist public health policy and decision making for better management of acute crises during flu season. Our review of the literature uncovered some themes. Monitoring systems and prediction systems were some of the outputs of the research work. The different diseases targeted included flu, but also swine flu, Ebola, dengue fever, and hay fever as well. There were different techniques involved in locating the social media messages, which is crucial if you want to benchmark it against traditional methods. And traditional methods are usually scoped to a very specific geographical area, and to ensure that you're comparing like with like, you need to ensure that your data that you're using is from the same geographical area. We also cover some classification techniques. As you can see in our taxonomy of the related work, the bulk of the research involved tracking current disease activities, so monitoring and surveillance systems really. The earliest work was Ginsberg's work at Google with his flu trends system, and that used the Google search logs from the search engine to see who had queried for flu related terms, and he predicted based on the amount of activity in the search logs how much flu there was out there in the population. He achieved some success rates with that in the early days, but later on the flu trend system suffered a lot from being overly influenced by current affairs and news rather than actual flu activity in the population. To get around that, some people have used sentiment analysis to try and bolster the results that they're getting and filter out tweets that are just related to news and tweets that are actual personal infection accounts. Other researchers have used sentiment analysis to measure public concern rather than individual infection rates. And yet other researchers have looked at transmission dynamics of flu, so things like the serial interval and the secondary attack rate, and the probability of somebody within the first person infected's own household becoming a secondary infection. We identified from the literature review various critical success factors, one of them being the geolocation technique. Some researchers relied on the tweet coordinates populated with the Twitter data. The problem with that is that less than 1% of tweets have GPS data with them, as a lot of people turn off GPS capability on their mobile phones when they're using the Twitter mobile app. So to get around that, some researchers used user profile data. Unfortunately, that suffers from a lot of nonsense. It's a fairly free text field and you can put anything in it. So things like Candyland or My Happy Place would have been in many people's profile fields, and that needs to be filtered out, and contents of the user profile location information would need to be matched to Irish place names and validated. Other researchers have used time zone data, but that's quite woolly, as we share a time zone with the United Kingdom and we'd need to be more specific than the time zone could offer us, really. As regards text mining, some researchers had success with a simple bag of words type approach, but more successful researchers used more complicated methods, such as N-gram modeling, TF-IDF, or they used particular ontologies of layman's terms and medical dictionaries and mappings between the two. Stemming was used quite a lot, as in bringing the word back to its root so that you maximize the amount of matches and are not concerned with suffixes such as ing or li or similar to that. Acronym expansion was very interesting as well. In social media, a lot of people use acronyms to get around the 140 character limit. In Twitter, now 280 character limit, but still where you're limited, you resort to the use of acronyms to get your message across. Forecast modeling used a number of techniques. We saw linear regression, support vector machines, and artificial neural networks. We might be interested in using naive Bayes as well, may be applicable to the problem space. And from an operationalization point of view, some researchers had managed to implement a continuous framework for ongoing surveillance of flu data. Our plan to answer this research question goes over about 24 weeks. It's organised really in a waterfall method here, which is a largely sequential one activity after another. Likely in reality, you would see this operating as a more iterative process where solutions are refined and repeated over a couple of iterations until moving on to the next task. So it's likely to be less of a waterfall in reality, but the benefit of plotting it out like this is that we can see quite clearly how close we are to achieving completion of the project to its deadline at any point during the project stage. In conclusion then, we set out to answer if Twitter data can be used to monitor and predict local influenza epidemics in Ireland. Having reviewed the literature, we can determine that critical success factors to answering this question are geolocation technique, are techniques for text mining, and putting in place a framework for continuous operation of our data capture. Thank you for listening.